Hello and welcome to Health 247. Today, we turn our attention to a health condition that quietly affects millions but carries loud consequences: asthma. Asthma is more than just shortness of breath. For individuals, it means living with constant vigilance, which they have to avoid smoke and dust because even exercise sometimes triggers it. However, it can disrupt daily lives, causing restless nights and, in severe cases, leading to emergency hospital visits. Asthma is a chronic disease that requires lifelong management. With the right treatment, patients can live normal lives, but without access to care, it can be deadly. To help us better understand the causes, symptoms, preventions, and treatment of asthma, we are joined by Dr. Mfoniso Ikpoto, a medical officer at Limi Hospital, Abuja. Dr. Ipoto has years of experience in respiratory health and is passionate about creating awareness on asthma management. Dr. Ipoto, it's a pleasure to have you on the program, Health
Thank you very
247.
much. Thank you for having me.
All right. So for those who are watching us home, if you want to be part of the show as usual, you can just do as well by following us on our social media platform on official Ravi TV. I remain your host, Irene Okechukwu. You on the program Health
Thank you very much.
247.
Thank you very much.
So we just go in immediately. Can you just tell us what asthma is and how it reflects on the lungs?
Okay, asthma actually is a chronic inflammatory disease, and it affects the airways, most particularly the bronchial.
Okay.
And when it affects the bronchial, usually it is inflamed and it is swollen. And because of this, the muscles around it begins to tighten and causes bronchospasm, and there's usually a lot of mucus secretion from it. So this will cause like cough, wheezing, chest tightness, and shortness of breath.
All right. So is asthma a hereditary condition or can anyone develop it?
Well, yes, it's hereditary. Most children that their parents are asthmatic tends to be asthmatic also, but also it can be acquired also from allergens, different kind of allergens, and respiratory infections, flu, and all those things. People who even their parents are not asthmatic can also get it too. So it's both.
So what do you think can trigger this asthma?
Well, there are different triggers. Number one, as I said, allergies could be from pollens, it could be from mold, could be from dust, and also, as I said, respiratory infections like the cold and the flu also can also trigger this. Then some kind of exercise, especially in cold air, so, like vigorous exercise, especially in cold air, can also trigger this. Tobacco smoke, air pollution also can also trigger this asthma. Then also stress and strong emotions sometimes can trigger. Then some medications like beta blockers, a medication that is used to treat hypertension, and when person has palpitation in hypertension. So yes.
Interesting. So what are those early signs that of an asthma patient may develop and what the person or the patient needs not to ignore?
Okay. First of all, frequent coughing, usually, especially at night and early morning. So we should pay attention to such kind of cough. Then also wheezing. Wheezing is like a whistling sound.
Okay.
Usually happens at the end of the expiration when they're breathing out. So there's a kind of wheezing sound like a whistle. So also that's another symptom of asthma. Then there's chest tightness. Usually patients will complain that the chest is tight and it's
chest pain.
no, well, not sometimes it's chest pain, but usually it is chest tightness and there's a lot of pressure in the chest. And also, person has reduced tolerance to exercise. So when the person wants to exercise, has started having this shortness of breath. So these are the signs that we should look out for.
Interesting. So how can asthma be diagnosed?
Okay, well, asthma is diagnosed based on the symptoms and also a test called the lung function test. So the symptoms, as I mentioned earlier, if you notice these symptoms, okay, the person can be asthmatic. Then lung function test, especially this spirometry, it's a test that used to check, for the airflow in the lungs. So that you can also use. Then also There's what we call the bronchodilator, like salbutamol, this inhaler. So when
Inhaler.
it is used, and the person got some relief, then we know that okay, this person is asthmatic.
Interesting. But can asthma be confused with other respiratory illness?
Yes, of course. There are some differentials. We call it differential diagnosis that could be confused with asthma. Like we have bronchitis can be confused with asthma. Then we have pneumonia. Of course, everybody knows about
Pneumonia,
pneumonia.
yes,
Yes,
exactly.
it can also be confused with asthma. Then we have also heart failure. But this one is for adult people and COPD, chronic obstructive pulmonary disease. This could be, seen to be like asthma, but it's not asthma because they have their own different features.
Oh. So in case of this, how can it be managed? For instance, there are
Okay.
some people that have chest pain and sometimes they have shortness of breath, but some people confuse it with asthma. So how do you think it can be or it could be managed?
Okay, well, asthma, first of all, in an acute condition, when the person is having these symptoms, it's advised to use the first response is to use the inhaler.
The inhaler.
Yeah, they call them, they are quick relief inhaler, like the salbutamol. You can just give about 2 to 4 puffs and repeat after 20 minutes if it still continues. But we also have like long-term use, also the long-term use of inhalers, too, like the inhaled corticosteroids.
Okay.
We have others like the leukotriene receptors, leukotriene receptors antagonists, where we have like drugs like the Montelukast.
Is it
So
more
these
like
are-
a tablet or what?
Yeah, that one is like a tablet. Yes,
Okay.
give that one. This is for long use, so to not come out again.
So you just spoke about the nicotine. I don't know if it's a recent kind of treatment.
Leukotriene, not nicotine.
Leukotriene.
Yeah, it's not. It's not recent. It has been there.
It has been there.
Yeah,
Oh,
leukotriene.
interesting.
Yeah.
So how is it important to use the inhaler and are there any misconception around them?
Well, yeah, inhaler is like the cornerstone.
Okay.
Thing. That is the. In fact, everybody who is asthmatic needs to have an inhaler with them because that is one life-saving drugs that you can use. Yeah, there are some misconception about them. Like people say that the inhaler is addictive. It's, of course, is wrong. And some people say that the using the tablet is stronger than using the inhaler. Is also wrong because the inhaler it sends the medication direct to the lungs and it's quite faster and it works even in small doses. So that one is also wrong. Some people will say that they are fine and they don't need their inhaler, which is also wrong. They always need their inhaler.
But there are some things that some people do when people are kind of alleged, when they're having these allergies, you see them, especially an asthmatic patient, when the person doesn't have his or her inhaler close by, you see some people running for milk. Yes, they'll be running for milk. They want to mix milk or add malt together and say, give him or her. He's going to relieve him or her. She's going to get herself back. I don't know. I have witnessed it back then in school when an asthmatic patient was running short of breath, and what they could do was we said they should open the windows. After opening the windows, to say they should create space for at least proper ventilation. The next thing they say mix milk and malt, and I still see it to this present day. Some people mix milk and malt and be given an asthmatic patient. So that's why I'm asking this misconception. What do you think about it?
Well, yeah, I'm just saying this for the first time. Mixing the milk and the malt and the milk, you said.
Yeah.
Well, I don't. It doesn't help. It doesn't help in asthma at all in any way. It doesn't help.
You
So yes,
just-
opening
Like the meat and-
ventilation. Yeah, yeah. Ventilation is okay. Yes,
Yeah.
because person needs like a lot of air, and if there's an irritant there, something that is allergic to, so more air can reduce the allergy. But mixing the milk and milk, it's first time hearing, and I don't think it helps at all.
So you were saying that asthma could be hereditary.
Yes.
Okay. Now the question is, can it be healed? Can it be cured? Or is it a lifelong thing that somebody has to carry all through his or her life till she departs this world?
Well, asthma cannot be cured.
Oh,
Unfortunately, asthma cannot be cured, but it can be very much controlled. And it can be
Okay.
controlled in such a way that the person can live his or her normal life like a normal person without these triggers. So the most important thing is identifying your allergens and staying away from it.
Staying
Then
away from it.
your medications. It can be cured, but it can be very well controlled.
So without that inhaler, can the person lose his life?
No. Well, of course not. There are a lot of people that are not even using their inhaler, they're asthmatic. But It's better to be with it
Okay.
because some people, because of maybe the medication they take and their good lifestyle, they are trying to avoid the allergens and all those things. Well, they can live without their inhaler, but it's always good to be with one as far as asthmatic. But it can be cured, but very much controlled.
Interesting. All right, viewers, this is Dr. Ikoto from Lemi Hospital. He is telling us the ways of how we can prevent or how we can manage asthma. So we're going to be going on a short break, and when we return, we're going to hear more from him. So just sit back and keep watching us. All right, viewers, welcome back on this break. And if you're still watching, for those who are just joining us now, do not forget to go on our social media handle and click the like button as well. Subscribe to our channel. So this is us talking on asthma today. So over to you, doctor. How can we prevent asthma attacks in the daily lives?
Okay, as I said much earlier, so preventing asthma attack is preventing and avoiding those allergens. Yes, to prevent and avoid those allergens. I remember a patient of mine who sells perfumes, and she likes strong perfumes, and she was once diagnosed with
And she's
asthma,
asthmatic.
and she's asthmatic. So that's the
Okay.
business she does, and I always ask, okay, yes, this is what gives you money, this is what makes you happy, but then again, there's still a disadvantage because she wears these perfumes too, and usually cause her different kind of attacks.
Attacks.
Sometimes she tries to deny it and all these things, but then again, we know that these are what because she keeps having it so frequently. So apart from having a nice clean house, because some of them can come from dust also, but these perfumes are like one of the cause of it. So those are allergens for her. It could be different for other people. These are the allergens for her. So also, as I said, maintaining clean home, dusty environment can actually be a trigger for this kind of a thing. And also, well, exercise regularly. As far as you are controlling your listen, because exercise can actually make
Can also
someone to
trigger,
have,
right?
trigger it. But then again,
What kind of exercise when you talk about exercise?
well, using the treadmill, walking, jogging,
Running.
Okay. Yeah. But we're doing it when the weather is very cold can be a trigger.
Oh.
That is why good control. You can actually do exercise when you have good control.
So in terms of running, an asthmatic patient, do you advise an asthmatic patient to take a long walk or run as fast as he can, or you should moderate the way he runs?
Well, depends. If the person is having a good control, like when I mean good control, there's no asthmatic attack, there's no like crisis in last years, last months.
Okay.
So of course the person can. There are athletes who are asthmatic and they are running and competing with other people, and they're also doing very well. As far as you try to control them very well, take medications, doctor is supposed to doctor, you can actually run. But if it's a problem, then of course try to avoid it. Yes.
Interesting. So, what role does environmental pollution play in worsening asthma cases?
Well, environmental pollution. Well, for instance, fumes from cars, industries, and all those things. Yeah, they play a very, very big role in worsening the case because these are allergens. These are triggers. So people living in places that are like very well polluted, especially children, they tend to be more affected by this, and they always have like crisis
regularly.
Yeah.
Wow.
Yeah, so this is not really good for them.
So, what do you think? How can we manage it? Like, for instance, those who are working in industries, you must work in this country to survive, to be able to foot your bills. And for those who are working in industries like this, how do you think they can avoid being going towards the place that could affect them? The place that they may be allergic to. How do you think they can
Well,
control this?
well, it's well to me. I think that they have to just learn how to, if they cannot be given another like position in such
Position.
industry, they have to learn how to like cover up. Like there are some maybe respirator, like a kind of mask you can
Marks,
wear,
okay.
that you can wear to like limit the flow of the flow of the gas around and allergies around them, because basically as far as you go close to an allergens, you're most likely going to start having triggers and all those things. Of course, if they take their medication very well,
Well,
see their doctors and do run the test and do what they're asked to do, most time they will be okay. Most time they'll be okay.
are there foods that can also affect them?
Food.
Yeah, food.
Yeah. Some food you said can affect. I
What type
don't
of
know what
food?
kind of food,
Okay.
but there are some food that can affect people, that can cause allergy and affect people. But most time, these allergies comes from like
Airborne.
and also respiratory infections.
Interesting. So, is there a link between climate change and the rise in asthma cases?
Well, yes. Actually, there's a link between the climate change, because some climate change, like for instance, while I was studying, because I studied in Ukraine, so during their summer period, they had this in front of my hostel, this pollen, this flower
Okay.
that brings up pollen.
Okay.
Anytime I'm passing there, I'm always sneezing, I'm always like coughing, I'm always having this condition.
Okay.
Though that was an allergic reaction, but that was not asthma.
It was not asthma.
But for people with asthma and those such kind of things, they're allergic. Yeah, it can be a problem for them. And this happened only during the summertime. But during the other time, I always feel better. So these are example of like climate change that can, cause these triggers. Then also extreme weathers. When there's like dust storms around, this can also trigger this thing. Then also like rising global temperature when the weather is very hot. It can lead to respiratory disease that can actually lead to these triggers in asthma. So,
Okay, talking from a plain individual like me, I am not a medical practitioner, and for instance, if I happen to come in contact with someone who is asthmatic and the person has his or her crisis, what is expected of me?
wow, okay.
Yeah. Because how do I now assist that person?
Okay. So the first thing you should do is someone who has a crisis is to keep the person to sit upright.
Okay.
It's very important. The person has to sit upright, and you have to encourage the person to be calm, because panicking actually worsen the condition. So the person has to sit upright and be calm. Now, if the person has an inhaler, that is why you see it's always good to have an inhaler.
Exactly.
You can actually assist the person or tell the person to use the inhaler, or assist the person to use the inhaler. So while you are doing this, of course, you are giving like 2 puffs,
Okay.
like in the mouth, 2 to 4 puffs every 20 minutes.
Okay, you just put the inhaler in the person's mouth?
In the person's mouth.
Okay.
And usually, those people with asthma, before they give them inhaler, they teach them how to use it.
Okay.
So you puff, they take a deep breath, they put the puff so that, they can take it in.
Okay.
It goes directly to the lungs and try to cause reduce the spasm and the symptoms of the asthma. So when they put this puff, but sometimes this inhaler in very severe crisis, they don't work. So, but you keep on doing it while we call for emergencies. So you keep on doing it like that while we call for emergencies when the inhaler is not working. Then do not ever tell the person to lie down.
The person should sit upright.
Yeah.
Okay.
Take the person to the nearest hospital.
So in cases where the person doesn't have his or her inhaler close by, or the person forgot his or her inhaler at home or the office, what should you do at that point?
Well, it's a difficult situation. But
Yeah.
I think
that's why I told you earlier on that there are some people that get so confused. They go miss milk and malt. It's crazy, but
no, it will not help. Milk and malt will not help. It's not going to help.
So
in that case, I think the best thing to do is to look for the nearest. Why you keep the person upright? The person to be
Do you
calm.
need to be fanning the person?
Well, if the place is quite stuffy, yes,
Okay.
you can. But if the place is like in an enclosed space, like you open ventilations, you have to come
Yeah.
in. This person to calm
Calm
down.
down.
Yeah, so the person can, because if the person is like panicking, is the person like will not be able to like breathe properly because that can worsen the situation. So the person calm down so that the air can come in and go in out very slowly. Then if there's someone that can help you to get an inhaler, the person should get. Meanwhile, while you're doing this, you are trying to rush the person to the hospital or calling, emergency service. So this is the best you can do for the person.
Interesting. Interesting. So, for what advice will you have to give to schools, workplaces, and communities to support people living with asthma?
Okay, for schools and communities, first of all, the first thing is for them to have trained personnel that can control this asthma. It's very,
Okay.
very important because, like, for instance, community where there is no good healthcare system, for instance, if this patient or this person who has asthma attack is not attended to quickly, this actually can lead to death.
Okay.
Yeah, so they need to have trained personnel that can,
Around.
yes, that can take care of this first aid. And also, children and adults should be allowed to take their inhaler. There are some schools that like don't bring like this,
It's
your book and paper and your pen. And stuff.
okay.
Don't bring this in. So they should be allowed to
Okay.
carry their inhaler wherever they are going to. And also, um, secondary school especially,
Like boarding school.
boarding school, for instance, some they'll make a roster and okay, you're the one sweeping the classroom. Classroom can be very dusty.
Yeah.
Yeah, especially in like public schools. So they say you're the one sweeping today, and the place is very dusty. So they should not be giving such kind of responsibility to people that are asthmatic,
Okay.
because in the process of doing it, they can be triggered. So they can give them some other things to do.
Okay.
It's not going to cause this trigger. So they should also.
So what about workplaces?
Workplaces? Okay, workplaces they should have like maybe emergency protocols in place in case of such kind of thing happen. And also, as we discussed earlier about the industry too, they should try to look for a place where they are not going to be, exposed to this allergy.
Allergies.
Yeah, so
Okay, I would like you to explain something on the myth or misconception about asthma. So, what do you need? I needed to correct something on the myth because some people have this thoughts that people who are asthmatic they can die soon.
Okay.
They can. It's not everybody that can manage them, and sometimes this even affects relationship. You see someone who is dating his girlfriend, all of a sudden when he just finds out that the girlfriend is kind of conversing or trying to, she's having shortness of breath. So the boyfriend or the guy to help, he will run. He'll take to his heels. At the end of the day, he'll say, "I can't marry her. Oh. I can't date her. Oh. She's going to be a problem to me." So I would like you to correct the myth or the misconception.
Okay, let me start with the one we said earlier, the one of the milk and the malt,
Yeah.
because it's wrong. It's not going to help at all.
Okay.
So asthma is not really something it's not like a death sentence kind of disease.
Yeah.
It can be easily managed, and if it is managed properly, sometimes you may not even know that this person is asthmatic. The person can live like a whole
Normal person.
yes, like a normal person.
Okay.
So also there's also the myth that asthma affect only children. Of course not. Of course, I've seen so many patients who are asthmatic. In fact, some of them are even having crisis when they came to the emergency.
Okay.
I'm talking about people above the age of 18. So it's not just for children. It also affects adults. Then also, asthma as I said, asthma does not have a cure. It doesn't go away. But it can be managed and it can be controlled. And when it is controlled, people can, live their normal life for a very long time. Then also, people with asthma, they say they should avoid exercise. So it's only when like for instance, it's not controlled very well. Exercise can actually trigger, but if it is controlled very well, of course they can partake in exercises and help themselves also. So basically that's it. And also some people say inhaler is addictive and it's dangerous. No, it's not.
It's not dangerous.
No, it's not. So every time that someone has this crisis, you don't even need to wait to have like very serious crisis. Once you just have like symptoms and like you cannot breathe very well, wheezing, it's always good for you to use an inhaler.
Interesting.
Thank you.
Dr. Ikwetu, thank you so much for this insightful information on asthma.
Thank you very
I hope
much.
you're going to visit us again and talk more, even if it's not going to be asthma, but another related topic.
I hope so too. Thank you very
All
much.
right. So we're going to talk about the health tips on how we can prevent asthma. All right. Asthma is not just an individual struggle. It is a public health challenge that demands attention. With better awareness, access to treatments, and cleaner environments, millions of lives can be improved and be saved. Together, we can ensure that asthma is managed, not feared. After all, every breath is precious. Thank you so much for being part of the program. I am your host, Irene Okechukwu, and we'll see you next time at the same time on this very program. Bye for now.